When a patient is in active myeloma treatment, how are they monitored?
So myeloma is actually a disease that has really good markers, right? Because the cells that cause myeloma are called plasma cells. These cells are part of our immune system, and their normal function is to produce antibodies, which is a type of protein. And these proteins we can measure in the blood or in the urine of the patients. So when a patient is diagnosed, we would say, okay, you have IgG kappa myeloma, for example. IgG is a type of antibody. These antibodies, we call them immunoglobulins, a more fancy name for antibodies. And we name them we abbreviate that like IG, and then we name them by letters, IgG, IgA. So when a patient is diagnosed, I am able to check at the blood and see what is the type of antibody that is being secreted by the particular patient myeloma cells, right? And that would tell me the type of myeloma that patient has. So if a patient has, for example, IgG kappa myeloma, then I can follow that IgG after the patient gets therapy, and also the kappa light chain. And I would know if the treatment is working or not, right? Because if the treatment is working, the levels of those proteins should go down.
Right.
And there's a more fancy, another test that we do that is called serum protein electrophoresis that gives us the monoclonal protein or the M spike. And that is very exact, right? That tells me exactly what is the amount of protein secreted by the myeloma cells. And I can measure that. And that's how we measure response. We say if the M spike drops by more than 50%, the patient has a partial response. If it drops by more than 90%, the patients have a very good partial response. And if the M spike goes away completely, that is a complete response or complete remission, which is the goal of therapy.